Good afternoon. My name is Matt Henschel. I'm the SNAP Operations Branch Chief for the Northeast Regional Office, and I'll be facilitating today's webinar. We're excited to have so many attendees joining us today. Because of the number of attendees, to minimize disruptions, we ask that you please remain muted with your camera off. Please use the chat function for any comments or questions, and please note we're recording today's webinar. Thank you. To kick off our agenda, it's my pleasure to introduce Tim English, FNS Associate Administrator for Regional Operations and Support. He's responsible for overseeing the operations of 7 FNS regional offices, the FNS Office of Emergency Management, and the FNS State Systems Office. Welcome, Tim.
Thank you, Matt, and good afternoon and good morning to our colleagues on the West Coast, and welcome. I want to start by thanking all of you, our SNAP state agency partners, for taking the time to attend today's webinar. And thank you for all that you've done over the past 2.5 years to meet the needs of SNAP clients and applicants during the pandemic. The pandemic has certainly introduced unprecedented challenges, but collectively we've been able to respond. And that is a testament to the hard work and dedication of all of you and your staff. So thank you very much. The end of the federal public health emergency brings its own transitions and challenges, not the least of which is the ending of emergency allotments. While at this point, we don't know the exact date that the federal public health emergency will end, FNS is committed to helping states do what they can to prepare. Today's webinar is part of that effort. You'll hear directly from your state colleagues about what worked, what didn't, and what they would have done differently. So I want to thank Idaho, Arkansas, and Arizona for being willing to share their experiences. Of course, there's only so much that we can share within a 1-hour webinar. Our panel discussion today will only scratch the surface. We recognize that many of you in the audience also have information to share that would benefit your colleagues in other states. I welcome you to add in the chat anything that you've done or are planning to do to prepare for the end of the emergency allotments. Our hope is that today's webinar will spur further discussion, information sharing, and planning between state agencies. So thank you again for your time today, and please let us know how we can continue to support you as we prepare for the end of the public health emergency. And with that, I'll turn it back over to Matt. Thanks again.
Thank you, Tim. I'm now going to turn it over to the FNS National Office for an overview of some things to consider as you prepare for the end of emergency allotments. If you have any questions, again, please put those in the chat. We'll save the Q&A for the end of today's webinar. I'm pleased to introduce Erica Kane, Chief of the Issuance Support Branch within FNS's Issuance Policy and Innovation Division, and Adrian Mason, a Program Analyst with our State Administration Branch. Erica and Adrian.
Great, thanks, Matt. So we're just going to pull up some slides.
Thank you so much, folks. Took me a minute to get my camera turned on for you.
All right. So as Matt said, National Office is here today to lay the groundwork on what the federal requirements are for states as they end emergency allotments. There are 2 requirements we are focusing on. First, the household notification requirements, and second being the client's right to a fair hearing. Next slide. So in May of 2021, FNS issued updated guidance on emergency allotments. That guidance is a very robust Q&A document, and one section pertains to the phasing out of EA. So everything we will be sharing today about the requirements can be found in that Q&A document. Okay, so household notification requirements. The ending of EA is a mass change. So what that means is individual household notices are not required. NOAAs are not required. At a minimum, what states must do is they must publicize the change through the news media or posters in local offices or general notices mailed to households. If a state would like to, they may issue a notice of mass change to households. If that's something you are planning to explore, we encourage you to go to this CFR and pull up the requirements of that notice of mass change. the slide you see includes the website for that notice of mass change. And then I'll turn it over to Adrian, who will talk about the right to the fair hearing.
Thank you very much, Erica, and hi, folks. Good day, good morning, good afternoon. So like Erica said, I'm very briefly going to touch on fair hearings, first here in the context of that Q&A document that Erica referenced, and then also briefly in the context of the waivers that we've been offering through the WIM system over the course of the pandemic. So first, this was a question in the Q&A that we have gotten a couple of follow-up questions from since, so I just wanted to take a moment to offer a clarification. The question is, does a client have the right to request a fair hearing because their emergency allotments ended? Now, the answer is yes, but. So yes, a client can request a fair hearing if they are disputing that their benefits were improperly computed, or if they're disputing that federal law or regulation was being misapplied. However, if a client is requesting a fair hearing only to dispute the end of emergency allotments, which is what we expect many clients would dispute, then states may deny these requests. And even if states accept these requests for a fair hearing, and this is important, states are not obligated to continue benefits at the previous level or the EA level. And this is per 7 CFR 271.1F. So to reiterate, yes, clients can request fair hearings, but only if they are disputing the computation of benefits or the misapplication of regulation. If it's just about whether or not EAs have ended, then states may deny those requests for a fair hearing, and if they choose to accept them, states are not required to continue benefits at the previous EA level. Now, this question, number 38, is very lengthy. You don't have to read everything that's on the slide here, but I'll try to summarize for you. The question, and this has something to do with what Erica was saying, is because NOAAs are not required, there's no NOAA period. So for what period of time would continued benefit requests for a household that meets the requirements I just discussed in the previous question be honored by the state agency? So in short, as Erica said, NOAAs are not required, but you can send a notice of mass change if you want. And if you want to send a notice of mass change, states should do that as soon as reasonably possible, but it doesn't have to be any sooner than it would be sending a NOAA. And the fair hearing request process then would be the same as the NOAA. So that notice period would be the period between that notice of mass change, which was optionally sent, and the change itself. Remember, if a state chooses not to send a notice of mass change, households have the usual 90 days to request a fair hearing. But again, no matter what, benefits only need to be reinstated at the previous level if the issue at hand is whether the eligibility or benefits were improperly computed. If the fair hearing request only concerns the end of emergency allotments, the state can deny the request and is not required to restore benefits. So now I want to speak very briefly about COVID-19 administrative waivers and the end of the public health emergency. And I'll include here a note at the end about the fair hearings waiver specifically, which should be news to the states on this call, and I hope will be helpful. So as a reminder, FNS and we here in SAB have been approving a few different waivers under 272.3C1 during the pandemic. These include the temporary suspension of claims activity, the extension of the ADH timeframes, and also the the waiver of fair hearing timeframes. Now, we've been extending these on 3-month extensions since about the beginning of 2022 per our most recent memo on this. We've been requiring justifications for extension, at least in SAB, which, to reiterate, should require why the state requests to continue the adjustment and how the state plans to transition back to regulatory compliance. These waivers have been ending on the waiver expiration date, and states have been required to submit data within 45 days of that expiration date. And this is not news, this has been in all the all the memos, we have not generally been planning to extend these waivers beyond the end of the public health emergency. However, and this is what I want to highlight here, we recognize, especially in light of what I was just talking about, that when EAs end, states might see an increase in fair hearing requests, right? Because clients will see, I'm receiving less money, what's happened, I want to talk to somebody about this. So, and again, this is news, and I want to stress this, we will consider waiver requests for the fair hearing timeframe extension specifically for up to 3 months after the end of the PHE. Justification is still required, including what the situation looks like, explaining an uptick in fair hearing requests and the like, But I want to stress that this is a new announcement. Unlike the temporary suspension of claims activity flexibility and unlike the ADH timeframes flexibility, we will consider extending requests for the fair hearings flexibility for up to 3 months after the end of the PHE to accommodate for a potential increase in fair hearing requests. Now, that concludes my comments. I'll hand it back to the group.
Thank you, Eric and Adrian. So the remainder of our webinar will focus on a panel discussion with 3 state agencies that have ended emergency allotments. As a reminder, please put your questions in the chat. I also welcome attendees to share in the chat any ideas or suggestions for things that your state is doing or has done to prepare for the ending of the EA. We all have the opportunity to learn from one another. So to start our panel discussion, I'll ask each of our panel members to turn on their cameras and to say a few words of introduction. I'll give everyone a moment to turn on their cameras, and we'll start with Mary Guzman from Arizona. Mary, when you're able to get unmuted, do you want to say a few words of introduction?
I think you're still on mute.
Well, let's go ahead and start with Kelly Jackson from Arkansas.
Hello, everyone. My name is Kelly Jackson, and I am the SNAP administrator here in Arkansas.
Thank you, Kelly. And I'll ask Haley Smith from Idaho to introduce herself.
Hello, I'm Haley Smith. I'm the program manager for SNAP at the Department of Health and Welfare. And yeah, thank you.
And I'll turn it over to Mary from Arizona.
We'll try this one more time. Can you hear me?
We sure can. Thank you.
Oh, perfect. Okay. Hi, all. Good afternoon. My name is Mary Guzman. I'm a program manager with the State of Arizona Department of Economic Security, and I oversee our SNAP policy and our legislative services team, and I appreciate the invite today. Thank you.
Well, thank you all for joining us for today and taking the time to talk with us about your experiences. We'll go through a few questions before we turn it over to the questions that arise in the chat. So first of all, to provide some context, can you each tell us about the circumstances leading up to the ending of emergency allotments in your state? How much advance notice did you have? We'll start with Mary in Arizona.
Yeah, so in Arizona, we really didn't have much indication leading into it, as probably most states. That's something they probably want to keep under wraps. So our emergency declaration was rescinded by the governor on March 30th of this year. And so April 2022 was our gap month, or our final emergency allotment month, which really gave us about a notice of adverse action time frame in order to get that communication out to clients.
Thank you, Mary. And next we'll turn to Kelly from Arkansas. Same question. What was the events that led up to the ending of emergency allotments in Arkansas?
So just a few things. The public health emergency in our state ended in May of 2021. So that was, a lot of it had to do with the decrease in case numbers of COVID. It had, a lot of our businesses were starting to open back up and go back to full capacity and things of that nature. So all of those kind of led up to our governor ending our PHE here. And so, yeah.
Thank you, Kelly. And Haley, same question.
Okay, so Idaho was kind of in a unique situation. We were actually anticipating the end of our public health emergency at the state level because economically Idaho was doing really well. And so we thought it was going to be lifted in July of 21. And then kind of coupled with that, we also had guidance from FNS that we had to add an additional $95 to the maximum allotment, which was going to require a lot of automation and change. So we didn't think we would be able to get that change implemented prior to what we were expecting our public health emergency to end. So that's basically what led up to the state determining or deciding that we needed to go ahead and do the ending of the emergency allotments. And I would say that we probably had less than 60 days notice to prepare for this change and to notify the public.
Thank you, Haley. Next question. What methods for communicating the end of emergency allotments did you find to be particularly effective? And let me start with Haley again.
Off mute. So we really leaned on communication with our partner network, partners such as Idaho Food Bank. We have a Hunger Relief Task Force, Retail Association connections, as well as we had Idaho Voices for Children. So we relied heavily on them to communicate through our partner relationship to customers and through the food bank network as well. And we also sent out notices to the participants 30 days prior to the EA ending.
Thank you, Haley. Same question, Mary, in Arizona. What methods for communicating the end of emergency allotments did you find to be particularly effective?
So much like Idaho, we also felt that communication with our partner community was very helpful. Our Hunger Advisory Council, Food Bank Network, and we also have other state agencies that are really community-based to get that message out. We also sent a mass change mailing, again, really allowing basically a notice of adverse action for our clients. And that was sent out for anyone who had received that final month of emergency allotment. And we tried to make that notice as communicative as possible so that it would eliminate any questions or calls that the clients might have. We really told them on that letter what the amount that they can expect for their household for the month of May. We also indicated other resources that were available to them and really guidance for them to start preparing for the effect of that change on their household. We also sent out e-communication or electronic communication in the form of email and text message, really just marketing the end of this program, and added that messaging to our IVR as well as the first and foremost message that you received if you were calling our customer care centers. Those are the items that I think had the most impact for us.
Thank you, Mary. And same question to you, Kelly.
So here in Arkansas, I first want to say that we had about a month advance notice for our ending of the PHE. I did not answer that on the first question. So some of the communication methods that we did use to notify, we used Facebook a lot to send out a blast message to everyone that's easily shareable and it's fast. We also prepare our field staff by making sure that they all receive the same messaging. So we kind of give a little, I guess, explanation rather as to why it was ending, and so that they can all give out the same information. And we also utilize our outreach agency, which is Arkansas Hunger Relief Alliance. They also helped us in spreading the word, especially to our elderly households that may not use Facebook a lot.
Thank you, Kelly. And something that you mentioned is a great segue into our next question, which is how did you prepare staff? And so let me turn that back over to you, Kelly, to see if there's anything else you wanted to share about some of the messaging that you sent to staff in advance of the ending of emergency allotments.
Well, we wanted to make sure that our staff was definitely prepared for the amount of calls that I knew we were going to receive for ending the public health emergency allotments. So we tried to give them as much information as possible, but still kind of keeping it confined to the same message. We did not want anyone giving out different types of information. So we wanted everyone to give out the same amount. So we sent out screen messages to the field, and not only to the field, which is our caseworkers and our supervisors and things of that nature, but again, to our customer service. We made sure that our communications team also knew what was going on. And, you know, that's the best thing, to give them as much information as possible without overloading them, so that the clients could understand what was happening.
Thank you, Kelly. How about in Idaho, Haley, how did you prepare staff?
So department took steps to notify our CSR or our customer service representatives and other client-facing staff with bulletins. So we provided a bulletin of the upcoming change, and then we also provided detailed talking points that they could use to assist the clients, as well as giving all of our staff an opportunity to, work through and talk through the talking points with their supervisors once something rolls out. So, and if something ever, landed or a scenario that came up that wasn't within the talking points, we did have an escalation path that they could follow to make sure that the clients were taken care of. Another thing that we do with our staff was to make sure that anytime that there is a decrease in benefits, they're trained to start looking for potential deductions and that could help maximize their allotments as well. So our staff are trained to recognize those types of things for our clients.
Thank you, Haley. And Mary, how did you prepare staff in Arizona?
Very much along the same lines. We did send a statewide urgent bulletin, policy bulletin, outlining kind of the reason why, when the last month could be expected, again, outlining some talking points, as Idaho had mentioned, and really, again, like providing the client with resources, other food resources that may be available outside of the SNAP program. We also provided we have third-party non-merit staff who are our first level of call contacts when calling into our customer care centers, and we made sure that they had some scripting available that was along the same lines of messaging to really explain the why behind the change.
Thank you, Mary. So our next question for the panel: what impact did you see on call volume, fair hearings, or other areas? And were there any notable steps that you took to prepare for or respond to these impacts? Haley, I'll pose that question to you first.
Okay. Yeah, with Idaho, we have the ability to use an IVR or a phone tree system to send out notification or to post a notification and change of benefits that's going to affect a large number of people. So that's something that may have been utilized for that. Also, we didn't really see an increase in call volume. We were anticipating it, but when we look back at the data, we see that there's no more of an increase in call volume or fair hearing requests than we have with the regular COLA changes that we have every year. And honestly, we think that that's because of our efficient notifications that we send out through partners and through the notifications we send out to our clients.
Thank you, Haley.
Yep.
Mary, what about in Arizona? Did you see an impact on call volume, fair hearings, and were there any notable steps that you took to prepare?
Yeah, so initially we did experience 23.4% increase in call volume month over month from April, which was our last payment month, and when our mass change notice went out, to the month of May, which would have been the first month with no emergency allotments issued. After that, from May to June, it was a 10.3% increase. And we've since tapered off. Now, most of our call volume is because we have backed out of our interview waiver most recently. So as far as appeals go, we did have a significant amount. We roughly run around 300 to 400 appeals per month. And for the month of April, we had 95 appeals specifically submitted just for the ending of the EA, and in May, 166, and still well over 100 for June. One of the things we did there is we looked at our internal appeals process and really tried to streamline the communication between the internal department agency that receives the appeal request, kind of does the initial review of the case to determine if there's something that needs to be addressed, and our actual appellate team with our administrative law judges, where that communication happens, and how can we, rather than doing a one-off per case, really bulk over between those two teams the appeals that are just for the ending of EA, because we know that they have the right to file, but we were not going to be doing benefits pending hearing on that. So that was one of the things that we did to address the increase in appeals. Client complaints, there was roughly a 6% increase from March to April, and that has since tapered off with maybe a handful for May or June. And I think that's really due to, again, the mailing to the client, the IVR script when they first call, the script if they actually talk to a worker, and then that communication with our advocacy partners and our hunger relief community outreach folks.
Thank you, Mary. And Kelly, what about in Arkansas?
So here, because we used Facebook to give that mass messaging, we saw a huge increase in questions and comments on our Facebook platform. Thankfully, though, we did, kind of give our communications team, they help provide the message as well, the right messaging to say and how to answer the questions. And, a lot of information did not come back to me. As far as phone calls, we also got a lot of phone calls as well. Not sure of the increase in percentages, but I can tell you that our manager in that department definitely told me that they've seen a very large increase in phone numbers, mainly because people were wanting to know why the PHE was ending. I think they more so understood the emergency allotment was needed to end because of it, but they did not understand the decision and how and why the PHE was ending, especially when there was a national PHE still occurring. As far as fair hearing goes, we did not see a significant increase in that at all. Again, many people mostly understood that it had to end, but did not understand why.
Thank you, Kelly. So final question, as we wrap up the panel discussion, do you have any recommendations for your fellow states, and or would you have done anything differently in retrospect? I'll start with Mary in Arizona.
Yeah, so the one thing I think we probably could have done better at was having that client notification really finalized, tested, and in production, kind of waiting for the flip of the switch to send it out as a mass mailing. We did take a look at multiple states who had already backed out, and their client notification kind of piecemealed what we thought worked for us, but the testing of that, the finalization of it really took up some valuable time considering we didn't have much time to work with. So that would be my one suggestion.
Thank you, Mary. Kelly, from your perspective, anything that you would have done differently or any recommendations for your fellow states?
More advance notice would have definitely helped from our local government, our state government, as far as getting the information out there. We had at least about 30 days, but it could have been a little less than that. So more advance notice would have been extremely helpful. As well, we could have also sent out mass notices as well to the households that would have given them the information that they needed without having to call in and wait for someone to answer their phone call, or have to post it on Facebook, or rely on, another recipient to give them information. So a mass mail out would have been helpful.
Thank you. And Haley, what about in Idaho?
So for Idaho, I did want to just make one suggestion that I think worked really well for us. And I didn't mention this earlier, is that we actually work directly with our governor's office in this decision. So we found it very helpful to have government elected officials to back this decision. that way it was a message all the way from the top, all the way to the bottom that was consistent, and a decision that was consistent. So, you know, like I said, we really were anticipating that because the economy was pretty much back to pre-pandemic, we thought that the public health emergency was going to end. And I think that, you know, helped us a lot having the governor's office and the director and everything support us in this ending of the emergency allotments. So thank you.
Great. Thank you all. So we'll now open it up for Q&A. Please go ahead and put your question in the chat. If for whatever reason you're having issues accessing the chat, go ahead and you can raise your hand, and we'll call on you. So let me give it a minute. I'm not seeing anything in the chat currently, but we'll give it a minute to see if anybody wants to add anything in the chat. Okay, so I see some questions coming in. The first one I see is, what were the most frequently asked questions? So I'll turn that over to whomever wants to respond first.
Well, I will start. The main question was why. And as I've, said before, it was easy for us to explain that the PHE was ending and the emergency allotments were ending. However, it was difficult for them to understand why that decision was being made during the height, or what they considered to be still the height of the pandemic. So that was the most frequently asked question in Arkansas.
This is Mary. I would echo what Kelly said. In Arizona, as I'm sure across the nation, we're experiencing, higher than average food prices right now. So it was really, even regardless of what explanation or the regulation or, how it was tied to the emergency declaration, I think that the clients had a real difficult time understanding why would you do this now? Because food was, and still is very expensive. So just really reiterating that. And a lot of what we also got is who else do I need to speak to get this changed on the federal level? Who's my congressman kind of thing. So be prepared to have some of that information available for your clients as well.
Thank you. So I see another question. When did Idaho officially end EA, and same for Arkansas?
I'm going to actually defer to Kristen Matthews, the former program manager over SNAP, because she likely have that information. Unfortunately, I don't have it.
Well, I can say for Arkansas, we ended it in May of 2021. We ended in May of 2021. And then we had our final, wind down month in June of 21.
Thank you, Kelly. And I see Kristen's popped up.
Kristen, can you hear me?
We can, yes.
Okay, perfect. Yeah, so I would say our emergency allotments ended in April of 2021, and the benefits were issued in May of 2021. So we were issuing emergency allotments a month behind as a separate supplement. So they weren't part of the regular benefits that went out. They were issued, we staggered for 10 days, and then they went out 11 through the 15th. So it ended in April, but the final benefit was distributed in May.
Thank you. So the next question we had in the chat is, did your local food banks experience hardship following ending of the emergency allotments? I don't know if there's anything folks are able to share anecdotally from what you heard from community partners.
I did not receive that type of information from our food banks. I do know that since it has ended, yes, now because of the inflation and everything, we do. But when it first ended, no, we did not. They never communicated that information to us. That was not a huge concern for them.
This is Mary. Since we ended in 2022, in the food prices or what they were. We did see even news stories immediately of lines at the local food banks. There wasn't really any communication from our partners to DES or to our department, since there really wasn't much we could do about this, but we did see it in media stories and news coverage.
And I think I can speak to this. I was a former emergency food assistance program manager, and at this time, food banks were not reaching out with any concern about that or seeing an increase. We were still receiving a lot of supplemental commodities from FNS at that time, and so that was kind of bolstering our food supply.
Thank you, Haley. I see a couple questions along the same lines. How many states are still participating in emergency allotments? So we have currently 36 states and territories that are still issuing emergency allotments and 17 states that have ended issuing emergency allotments at this point. Did any of you see an increase in change reporting after the end of emergency allotments? Would you have statistics or just can comment anecdotally from what you may have heard from the field?
This is Mary for Arizona. I can't say that we did. Obviously, that would be part of the conversation if the client did call, and that 20 to 30% increase call volume is, do you have any changes that you'd like to report, considering the fact that we were extending cert periods for quite a while there. But as far as actual reported changes, we didn't see a significant increase in that for Arizona.
And that would be the same for Arkansas. With the PHE ending, we saw a decline in SNAP participation because people were no longer eligible for, extra benefits or, things of that nature. So we did see a decline in July, starting in July of 2021 in SNAP participation, but not an increase in changes.
Thank you. So it looks like the next question is a two-part question. The first is around the federal public health emergency. And so I think I'm safe in saying that we're still anticipating receiving 60 days notice before the ending of the federal public health emergency. And we've not yet, that notice has not yet been given. So while we don't know the exact end date for the federal public health emergency, the 60 days notice hasn't been provided yet. And for that the second part of that question, I think the commenters asking about general indication of the caseloads within each of your states to get a sense of size compared to what they may be experiencing in their own state. So if you have any just general numbers on participation or issuance.
This is Mary for Arizona. Our caseload runs around 350, 360,000. And we have seen a little bit of off as we get through. Sorry, Kelly.
I was going to say that was around the same for Arkansas. That's the normal participation rate. It's about 300, maybe 350.
Thank you. And it looks like in the next question is about getting a link to the memo, and it looks like we've already provided that link in there. Sorry, just scrolling through. So next question is, did you provide community outreach partners resources to help spread the word? And if so, what?
For our outreach here in Arkansas, we pretty much gave them the same information that we distributed from our communications team and to our field office staff, because again, we wanted to make sure that they all received and gave out the same communication. We did not want anyone kind of deviating as much as possible from the message that we put out.
And this is Mary for Arizona. We really directed everyone to our agency website where we have quite a few other food related programs. But our community advocate partners are much more versed on what's out there than we are. So there really wasn't a lot of them coming to us asking for resources. It was really more us going to them saying, is there anything we're missing here that may be available?
And for Idaho, we didn't have any community resources available, but we did share the notices with our partners that clients would be receiving.
Thank you. And so I think the next unanswered question is around reinstatement of the ABOT time limits work requirements. And since that's part of the federal public health emergency, I'm not sure if there's any anything that you'll be able to comment on from within your own states. I know there are some options for when clients are provided with a qualifying work component, but was there anything that you'd want to share along those lines from your state perspective?
Luckily, Arizona, we're under a statewide waiver, and we just submitted a request to extend that through federal fiscal year 23, which is a blessing considering the other 10 million things we have going on. So we're lucky that's not one of the issues we have to deal with.
Thank you. Let me just pause to see if I either missed any questions or if anybody wanted to put anything else in the chat. All right, well, I want to thank all of our panelists for taking the time, for sitting on the hot seat. Really appreciate that, and for sharing their experiences. So thank you, Mary, Kelly, and Haley. I also want to thank Erica, Adrian, and Tim for being a part of the webinar. And a special thank you to all of the participants. I think we had about 170 plus joining the call today. So really appreciate the interest from everybody. And again, let us know how we at FNS continue to support all of the states as you prepare for the ending of the of emergency allotments in your state and the ending of the federal public health emergency. So thank you again to our panelists. Thank you, everybody.
Yeah, bye.
Thank you. Thank you.